Welcome. November is Diabetes Awareness Month. I recently learned that the discovery of insulin happened during this month by Frederick Banting. And that's why it is in honor of it. You can wear the color blue in honor of diabetes awareness. It is sadly the fastest growing chronic illness and condition in this country. And it's also very much easy to, manage with the proper lifestyle and changes and the treatments available to us. We have two experts in the room today, which we are really grateful for their time and their knowledge that they will be sharing. Haseena Mirza is a physician assistant specializing in endocrinology for 15 years, practicing in both Arizona and Southern California. She's a board certified advanced diabetes management practitioner by the American Association of Diabetes Educators. She now practices in an endocrinology private practice in Fountain Valley. Her interests are in diabetes management, PCOS, and thyroid care. Gwen Adame is a registered dietitian who earned a Bachelor of Science degree in Nutrition and Dietetics and a Master of Science degree in Nutrition and Wellness. She also holds a certification as a Certified Diabetes Care Education Specialist. She currently works in an acute care hospital setting as a diabetes educator and is passionate in serving her community. So thank you both, Gwen and Haseena, for being here today. Haseena, I'm going to put the spotlight on you first, and you're welcome to share your screen if that's what you're planning to do, or if you're talking, that's fine as well.
So today we're talking about diabetes. Like Zainab said, I do specialize in endocrinology and have been treating diabetes patients for quite some time. And it is quite a big topic to go over, but I'll try to hit some of the points as well as I can. I'd like to discuss things that I wish patients would know before coming to see me, because a lot of the work can be done before having to see an endocrinology practice. So what is diabetes? Diabetes is a condition when the body struggles to manage the blood sugar. So there's three main types of diabetes. There's type 1 diabetes, which is autoimmune. And that is when the body does not produce enough insulin. So that's more rare. The more common type of diabetes that we need to discuss is type 2 diabetes, which is more often related to diet, lifestyle, and it's when the body does not utilize the insulin. So basically, yeah, so I think just the second slide. Yeah, very good. So like I said, there's type 1 diabetes, type 2 diabetes is the most common. And we also hear about gestational diabetes, which is diabetes during pregnancy. There are other types of diabetes that are more rare, and we won't go over them today, but just to keep in mind, there are other types of diabetes. Okay, next slide. Okay, so some of the more common symptoms of diabetes are frequent urination, so having to go to the bathroom more frequently, feeling thirsty all the time, feeling fatigued, having blurry vision, mood changes, prone to infections. So these are just some of the common signs and symptoms of diabetes. Now, that being said, diabetes is also known as a silent condition. So sometimes you could be feeling perfectly fine, and your diabetes is not under control. So these are some signs that you should talk to your doctor about getting tested for diabetes. But on the other hand, if you do find out you have diabetes and you're not feeling of those symptoms, that's also completely normal. So yeah, just keep that in mind, that it is also a silent condition. Okay, next slide. Okay, so why is diabetes dangerous? Why do we stress diabetes so much? Because unfortunately, diabetes can cause all types of horrible conditions all over the body. Heart disease is increased by almost 4 times. Heart attack, stroke, can cause kidney failure, eye issues, blindness. It's one of the most common causes of blindness. Can cause nerve damage. Other common complications, depression. It's now being shown to cause an increased risk of Alzheimer's and also bone disease. So all of these are very, very severe complications. They can increase the cost burden of treating patients. So it's a overall very, very complicated issue that we need to look at. Okay, next slide. So the prevalence of diabetes, as we talked about, it's a huge problem, especially in the age group of 65 plus. So there's more, in the US, there's more than 16.5 million seniors with diabetes. So another, I didn't write this in the slide, but another population that diabetes is growing in is in childhood. So there's a lot of children now with diabetes because of our diet and our lifestyle. So it's a huge issue. And of course, with olive, it's also a big issue because it's more prevalent in minority communities and South Asians, Arab communities, Black communities. Overall, minorities have a much higher prevalence of diabetes. Okay, next slide. All right, so how do we diagnose diabetes? You're gonna hear this term hemoglobin A1C at your doctor's office, and many of you already know what it is, but it's just important as a reminder. The hemoglobin A1C is a 3-month average of how your diabetes, how the glucose is affecting your now, under 5.7 is pre-diabetes. I mean, under 5.7 is normal, over 5.7 is pre-diabetes. Now, pre-diabetes is very, very important because if you have pre-diabetes, you're more likely to get diabetes in the future. So that's when you really, really want to work on all the lifestyle changes. So when your doctor tells you you have pre-diabetes, it's just as important to take some steps right away so that you don't develop full diabetes. And then diabetes itself is with a hemoglobin A1C of 6.5. So 5.7 to 6.5 is pre-diabetes, and above that is diabetes. Okay, next slide. So when we're talking about glucose, you will often see glucose numbers on your blood test results, or if you're already doing finger sticks, you're getting a good reading of your glucose numbers. Now, under 100 is normal fasting. So we're talking about when you wake up in the morning before you eat breakfast. Under 100 is normal. From 100 to 128 is pre-diabetes, fasting in the morning. And then above 128 is diabetes, or 126, sorry. So if you get a reading of over 126, you're already diagnosable as diabetes. Okay, next slide. Okay, so a little bit more about the minority populations that, most of us in Olive, we have different cultural practices and genetics. So there's some special considerations. So most minorities are actually diagnosed at a later stage. So they're diagnosed once the diabetes is already at a more severe level. So that's one issue. Another issue is obviously the diet. So many of our diets, our cultural diets, are very high in fatty foods and carbohydrates And we're going to talk about diet later, obviously, but it does lead to a lot more severity in the diabetic population. Another issue is inactivity, whether it's cultural or our lifestyle here in Western countries. We're not walking as much or exercising as much. Our populations are less likely to seek treatment, so less likely to go to the doctor for whatever reason. We are also found to have a higher rate of complications at even earlier stages. So that's heart disease, stroke, foot amputations, all those things at earlier stages of the disease. So we have to prevent those complications even more. Back to food, there are cultural barriers around food, like not finishing your plate is a bad thing. Eating is very social in our cultures, and there's a lot of social stigma around not eating with the family. Those kind of things, they can make another barrier to treating diabetes. And one more thing is diabetes occurs at a lower BMI. So there's something called skinny fat, where people can present as lower weight, but they're still at higher risk. So that's especially in Asian communities, that at a lower BMI, the normal cutoff of BMI is over 25 or 26, but at patients present with diabetes at an even lower BMI in certain minority populations. So all of these challenges make it a little bit harder for patients to deal with their diabetes, especially when I see people in my clinic, especially around the food and the culture. Some of these issues can really make it harder to get the diabetes under control. Okay, next slide. Okay. All right, so now these are the lifestyle changes that can help prevent diabetes. And also, once you have diabetes, the goal is to bring your blood sugars down so you don't get all the complications that we were talking about, like the heart problems, the stroke, blindness, all those things. So the more that we do with our lifestyle changes, the less that you're going to have to worry about multiple medications and complications. So first of all, what we're going to talk about later is a healthy diet, obviously, so I won't go into that now. Exercise is also very, very important. So exercising at least 30 minutes a day, whether it's walking, some light to moderate activity for 30 minutes a day, walking after your meals is going to be crucial, and also weight training. So most people don't think about weight training, and it's actually very, very important to keep your metabolism at a decent rate. So weight training, whether it's yoga, some light weights, is very, very important. And then finally, losing weight. If weight is an issue, losing 7% of your weight, sometimes 5 to 7% of your weight, can drastically lower your blood sugars and help the diabetes control. So these are just some of the lifestyle changes. Obviously, drinking and smoking are going to be something that has to be modified. But these are very important issues, so that if you can improve your lifestyle, you won't have to take multiple medications later on. And if you don't have diabetes, if you're in the pre-diabetes range or even before that, you can prevent the onset of diabetes. Okay, next slide. Okay, so I'm going to talk briefly about medications. I won't go in too much detail because there's so many medications, but the ones that you should know are metformin, which is the most common diabetic medication that we use. It's very safe, and most of you who have diabetes will be on metformin at some point. Now, there's two newer types of medications that are on that we use very commonly. They're the GLP, the once-a-week injections. There is an oral form, like Ozempic and Mounjaro, and then the SGLT2 inhibitors, which are Jardiance, Invokana, Farxiga. So I want you to keep those in mind because they're used a lot more by your providers because in general, they can help with the complications. So they can help prevent heart issues, cardiovascular issues. They can prevent kidney damage. So sometimes we don't want to change our medications that we've been on for a long time. But when your doctor sits you down and talks to you about these newer medications, there's a reason, because they're proven to prevent some of the complications. And you should really have an open mind, listen to your doctor. And if you do have heart issues or kidney issues, you should probably have that discussion with your provider. There are other medications out there. The only one I want to mention is the glipizide and glimepirides. Those are the older medications. They can cause hypoglycemia, and we're using them a lot less. So the issue that I have with some patients is they've been on it a long time, and they're used to those medications because they do tend to bring down glucose numbers. But in the end, we tend to try to get off of those medications as much as possible, especially in our senior populations, because they can cause low blood sugars. And then finally, insulin injections are still used. We tend to use them as a kind of later last resort. Now, more often we're using those other medications that I talked about in the beginning. But yes, insulin is also used. And one caution is it can also cause hypoglycemia. Okay, next slide. Okay, so this is for patients who already have diabetes. Nothing to memorize here, but in general, we want to keep your glucose levels down from 80 to 130 before eating, and 2 hours after the meal, less than 180. And we want to keep a hemoglobin A1C less than 7%. So that's the number that we were talking before, that above 6.5 is diabetes, but we want to keep it at a good control from 6.5 to 7%. Now, in our older populations or patients that have multiple medical issues, we do tend to relax that sometimes to 7.5 or even a little bit higher. So when you have that discussion with your doctor, that's why it might be a little bit more relaxed. But in general, if you're otherwise healthy, should be under 7%. Okay, next slide. Okay, now, once you do have a diagnosis of diabetes, it's very important to have those conversations with your doctor about your yearly exams. You should have your eye exam, your foot exam, and in fact, you should be checking your feet every day. Because of the numbness, you can get infections on your, you can get blisters and sores, and you won't feel when you have any kind of breakage on your feet. You really have to concentrate on managing your blood pressure and your cholesterol. So have those discussions with your doctor, and just understand why they're putting you on multiple medications is because we want to reduce the risk of further complications. So managing your blood pressure is very, very important, and your cholesterol. I just listed some other scans and screenings that we're doing more often in our diabetic patients. Ankle brachial index to check for peripheral artery disease, DEXA scan to check for osteoporosis, and then depression and memory screening. And then seek a specialist, if your diabetes is not under control. Sometimes going to endocrinologists or nutritionists can help you manage your diabetes a little bit better. But that's definitely an option out there. Okay, next slide. Okay, so in conclusion, diabetes is a very complicated disease, but once you get a hold of it, work on your lifestyle, work on having a good relationship with your doctor, it should be very, very manageable. I'm hoping some of this information is helpful. I'm sure we're going to have questions at the end, and that's about it.
Thank you, Haseena. I appreciate that. That was great information. And as I mentioned before, we will have a Q&A towards the end of the session. So hold tight for that. If you have questions at this time, you are welcome to put them in the chat. Our next speaker is here as well. Let's welcome Gwen.
Thank you so much. Thank you so much for this opportunity. Yes, it is Diabetes Awareness Month, so thank you for the opportunity to come and speak with you all about this topic. Let me see if I can get my slides going. Oh, there we go. Okay. So looking at diabetes, you may wonder, how common is it? And amongst United States adults, there's just over 38 million people living with diabetes. Unfortunately, over almost about 9 million adults, though, in our country actually are unaware of their diagnosis. So, as has already been mentioned, right, we look at controlling blood sugars because controlling blood sugars within a context of diabetes is very important to help prevent complications from diabetes. So we do look at that through medications and making sure that you're taking your diabetes medications as prescribed, talking with your provider if you have any complications or concerns so that your medications can be adjusted accordingly. Sorry. And then exercise is definitely an important component. We want to make sure that you're exercising at least 150 minutes a week. And as has already been stated, we can break that down into 30 minutes, but this could also be as simple as 10 minutes, 3 times a day. So we want to make this a doable goal for everyone. And then what we will be focusing on today more specifically is the diet aspect and looking at making sure our carbohydrates are consistent and spread throughout the day, and understanding that there is a recommended dietary allowance for carbohydrates, and it is a minimum of 130 grams a day. This is obviously, you know, when we talk to people who are living with diabetes and making recommendations, we make more specific recommendations for each individual. So why do we look at these habits? We touched upon this a little bit, you know, making sure that we're getting all the right sleep, managing our stress, exercising, and diet is so important because it has a direct impact on our blood sugar trends, our weight, our overall nutritional status, and our blood pressure. And all of these things come together to make an impact on our overall health and well-being. So when we look at what we typically eat for a day, our diet's composed of micronutrients and macronutrients. And as you can see, the micronutrients include the vitamins and minerals that we include from our foods. Macronutrients would be your protein, calories, your protein, fat, and carbohydrates. Each of those give varying amounts of calories per gram, but you can see that protein and carbohydrate give 4 calories for every gram eaten, and fat gives 9 calories. So looking more specifically at protein, you can see that our protein is an important component because it is known as a building block of the building blocks of our body. It's found in many tissues, muscle, various tissues in the body, and they're used in hormones. So we do look at kind of what is more often to be chosen, less often. On the left, you'll see those are the more often choices. And those are because they offer our body more nutrition. They have a bigger bang for our buck. On the right-hand side, you see foods that have a little bit more saturated fat, like whole fat dairy products and some of your red meats. Processed meats also can be not so healthy for our hearts. And things like imitation crab are not only processed, but they could actually have some added sugars to them as well. When we look closer at fat, we see, as we saw before, fat has a higher amount of calories per gram eaten. And this is a source of stored energy for our body. It provides insulation, it helps cushion our organs, it really helps support cell growth. So generally speaking, we're looking at including more of the unsaturated fats, small amounts of unsaturated fats throughout your day. And we highlight here, I'm highlighting the omega-3 and omega-6 fatty acids because we do want to keep those in balance. The omega-3 fatty acids, however, are an important source because these fats in particular are crucial for building and maintaining healthy cell membranes, which essentially helps support proper cell communication and making sure that we're helping those cells facilitate the transportation of nutrients and waste products throughout the body. So we want to make sure we have a good amount of those as well. So carbohydrates is usually where we focus for diabetes. We know that this is a primary fuel source in our diet. And when anybody, diabetes or not, breaks down these foods in the body, our blood sugar rises. So that is normal. But when we're looking at diabetes and controlling that blood sugar, we really want to make really good choices for these carbohydrates in particular so that we limit the amount of sugars that are hanging around in our blood. So you can see once again on the left side are our more nutritious, wholer, minimally processed sources of carbohydrate that we would prefer to have over the right-hand column. So as you see with grains, this is going to include things with more fiber, things like whole grain cereals like oatmeal or whole wheat breads. We want more fresh fruits. We want lower fat choices on dairy products, whereas the right-hand side offers more of a processed product, those that tend to be, not only could be higher in simple sugars like pastries or cakes or juices, but it also could offer things that are fried and more processed like samosas. So those are sources that we want to limit, in our daily diet so that we kind of help control those things. And you can see on there, we talked about, a lower fat dairy product. Things that are whole fat dairy are going to have a little bit more saturated fat. Things like ice creams and lassis are going to have more added sugar as well. So when we look at sweeteners, usually when we're talking about sweeteners, most people think of these as the sweeteners. These are nutritive sweeteners. As dietitians, we call these nutritive sweeteners because they do directly give us calories and impact our blood sugar. These are composed of simple sugars. So if someone who's living with diabetes has a low blood sugar, this is something that we would give them to bring their blood sugar up very quickly. But for a day-to-day basis, this is something that we don't want to have too often in our diet because of the fact that it does have a direct impact on our blood sugar. So these you could see are like sugar, honey, maple syrup, molasses, agave nectar. So we want to limit the amount of simple sugars we're getting from the diet as well. On the other hand, this is when people think of quote unquote diet foods, this is composed with more of these non-nutritive sweeteners. They don't impact the calorie level, they don't impact the sugar level, but subjectively they are hundreds to thousands of times sweeter than table sugar. So you can see on the left-hand side is their kind of generic name, on the right-hand side is their brand name, and there are many more always coming out. It's almost as abundant as the amount of diabetes medication. So it's hard to keep up with. So this is just a small selection. So the question is always, are non-nutritive sweeteners okay? They are approved by the FDA. They are considered a quote unquote GRAS food, which means generally recognized as safe. They do have established acceptable daily intake limits. But there is some information we need to still know. There is some more additional research that we would like to do in terms of what's the impact of your length of exposure? How long have you been using these products? Do they impact the cardiometabolic health? Each individual personal response to it. What's the impact of those non-nutritive sweeteners in the presence of other components in the diet? So no one is sitting down and just having a packet of Splenda or Sweet and Low. We're having that in the context of other foods. So we need a little bit more research on that impact. Also the impact of our microbiome. Again, these are subjectively sweeter. So there is some school of thought that, because they're subjectively sweeter, sometimes they do kind of encourage our taste buds to want a sweeter flavor all the time. So this is kind of some of the caveats with these. And we do have, unfortunately, not enough randomized control trials with these products. So this is the gold standard for research, a randomized control trial where we, kind of control every component so we really see what the effect is and get rid of all the potential variables that could be impacting it. So looking more specifically, diving a little deeper into carbohydrates, sometimes we talk about carbohydrate counting or we talk about a diabetic exchange. So we say that because when we're talking about looking specifically at carbohydrates, we want to kind of compare apples to apples. So when we do this, we're looking at serving sizes of 15 grams of carbohydrate per serving. So we whittle each food down into what could give us 15 grams of carbohydrate. This gives us a way of, if we were planning a meal and thinking we were going to have X, Y, and Z, and we decided that we wanted a little bit more of one thing than another, we can exchange one of those carbohydrates for another. And so this is just kind of a more simple way to look at things more broadly in a day-to-day basis. So these are our typical main sources of carbohydrate. They include things like fruits and grains, starchy vegetables, and some legumes, and as we said, milk and yogurt. So these are, of course, not an exhausted list. This is just some, but you can see a fruit could be like a medium-sized date, or a half a cup of pomegranate seeds, or a baseball-sized piece of fruit like an apple. Depending upon the size of the bread, it could be one slice of bread. Obviously, chapati could vary in size as well. We're talking about a 6-inch diameter. So things like that we're looking at, these are kind of equivalent. The only little bit of a caveat is half a cup of cooked lentils is slightly over 15 grams. It's about 20 grams of carbohydrates, but most of these are exchangeable, so to speak. So when we're looking at reading labels, we actually really want to focus on a few things. So we always start with the serving size on the label because that's what the label is based off of. So all those calories, fats, carbohydrates that we're looking at, that's in relation to the serving size as defined by the manufacturer. This can be really confusing because, for instance, for breads, some manufacturers might say 1 slice, some might say 2 slices. If you miss the serving size, you could really over-calculate or under-calculate what you're doing when you're looking at the total carbohydrate. And we do actually want to look at the total carbohydrate, not the grams of sugar. As you can see, the fiber and the sugar have been indented, and those are actually included in the total carbohydrate. So for this product in particular, 2/3 of a cup is a serving. If we were to say we were eating that 2/3 of a cup, this is 37 grams of carbohydrate, which would be roughly 2.5 carbohydrate servings. Generally, I'm a big fan of the plate method because it's really cumbersome to sit here and start counting calories or counting grams. We want to see also that we are, as humans, we do sometimes fall off the wagon a little bit, and we want to see every meal and snack as an opportunity. Maybe you missed the boat a little bit on the last meal. The next meal is your next opportunity to kind of refresh and try again. We want broadly general, right? Half of your meal or snack should be non-starchy vegetables. That's most all of your vegetables. That's, broccoli, cauliflower, carrots, cabbage, you name it. What we put in the carbohydrate category are those starchy vegetables and some of the beans and lentils that we talked about, maybe potatoes, in addition to the rice and bread and such. And then we want a little bit of a lean source of protein. And the reason we want this combination is vegetables with the fiber and protein tend to digest a little slower. It helps carry the carbohydrate so that the blood sugar rises a little bit more gradually. These here you can see are very general guidelines. Specific recommendations are going to vary by individual circumstances and your medical history, but broadly speaking, we look at about 3 to 4 servings of carbohydrate. So again, that would be like 45 to 60 grams of carbohydrate for women, 4 to 5 servings for men at each meal, and maybe 1 to 2 carbohydrate servings at snack times. So when we look at how do we apply this to a day-to-day meal, starting off the gate with breakfast, we have oatmeal, a half a cup, cooked in water. I know that some people might cook it in milk. That's obviously going to change the carbohydrate content. We have some fresh fruit. We have some nuts, flavor of cardamom and cinnamon. Interesting, right? Cinnamon is a great flavoring aspect. It does also help our ability to kind of cut our desire for sweetness, if you will, right? We're kind of deepening the flavors, making the food more interesting, hopefully having the fruit be our sweetener, so to speak here. But cinnamon, as you may have read, you know, it can help somewhat with lowering blood sugar. So it's kind of 2-for-1 here. And then we've got a boiled egg to balance it out with the protein and some non-fat milk. So just for time's sake, I'm just going to skip to the answers. When we look at these, you want to think in your head, which of these foods would be considered the carbohydrates? And so this is the breakdown. We have that half a cup of oatmeal. That's roughly 15 grams of carbohydrate. We have fresh fruit, another 15 grams. You saw if we substituted a banana, most bananas are larger. So most larger bananas are 2 servings. So half a banana here. The nuts are going to be that source of good, healthy fat. The boiled egg is going to be a source of protein. And milk, although we do count 1 cup as a serving, it's technically about 12 grams of carbohydrates. So for this meal, this is roughly 42 grams, which is about 3 servings of carbohydrate. So here's an example. I have 2 examples for lunch, so you can just kind of see a comparison. So here we have 1 cup of chana masala. We have 2/3 of a cup of brown rice, and we have some roasted cauliflower and carrots making up 2 cups, and some water with some lemon slices to round out the meal. So when we're thinking, okay, again, carbohydrate.
Oh, you want to do
choice,
white laundry? Okay.
what would we be looking at here? Here we would see that the chana masala would be about 45 grams of carbohydrate. Our brown rice would be 30 grams of carbohydrate. Our roasted vegetables, again, those are non-starchy vegetables, so that we don't really count those. They do have a small amount of carbohydrate, but again, not where we want to focus. So this meal would provide 75 grams or 5 servings. And so you could see here, you could exchange some of the carbohydrate sources for something else. For instance, if you wanted to have a piece of fruit in here, we can make some adjustments to this meal and exchange one for another. So just kind of on the flip side, if we substituted the chana masala with chicken curry 1 cup, and we did 1/3 of a cup of brown rice, again, maybe we were thinking we wanted some fruit, so we added some pomegranate seeds. We decreased the brown rice just a little bit, noticing that it is brown rice, right? It does have more fiber, and that is very good for the digestive tract and also for helping control our blood sugars in a little bit more of a stable manner. We put in here a 6-inch diameter whole grain chapati, a little bit of hummus, and some roasted Brussels sprouts and some chamomile tea. So how this one breaks down is the chicken curry doesn't have too much carbohydrate. You know, when we're making curry, if we're adding cream, we want to look for some lower fat alternatives. The brown rice, again, 1/3 of a cup is about 15 grams. The chapati has 16 grams, the hummus 15 grams, the Brussels sprouts really we don't count. Once again, half a cup of pomegranate seeds is a serving. So this meal, you can see, has a large variety of different foods, gives us about 69 grams or about 4.5 servings of carbohydrate for that meal. I think I heard something about biryani. So we do have an example for biryani made with chicken and 1 1/3 cups of brown rice, some yellow, red, orange bell peppers, onions, and tomatoes. For dinner, we also served it with a half a cup of raita, and we rounded it out with some lemon ginger tea. So when we think about the carbohydrates, we look at mostly, right, the 1 1/3 cups of brown rice is going to give us 60 grams of carbohydrate. The raita is going to give us about 16 grams of carbohydrate. And so this meal is 76 grams of carbohydrate, or roughly 5 servings of carbohydrate. So you can see there is a way to really give you a good variety of food. We've got lots of delicious flavors. We've got lots of delicious colors. to excite our palate and our eyes. We do eat with our eyes, and we want that food to be enjoyable. And these foods can be your favorite foods, but how we fit it in and kind of how we make some adjustments is where we want to look at it. So in summary, we talked about lifestyle changes, getting that diet, getting that exercise, making sure you're taking your medications as they've been prescribed. But again, if you're having questions about your medication, if you don't know how your medications work, if you have concerns, you heard something from someone else, and you're not taking your medications, this is an important point to really bring to your medical provider so that they are understanding where you're coming from, because really you are your best source of information as far as how you want to advocate for yourself. You want to make sure that if you're concerned that you discuss these things, because with all these things together, there can be diabetes remission. So we don't really say that it goes away per se, but this could be that you are now able to manage it with diet and exercise. We really want to also look at small, realistic changes. So as humans, we live very much off of habit, and it's great if we could make it all better and different tomorrow, but that's really not how we work. So we really want to look at what's doable for me. What can I do right now that doesn't feel so painful? I think I can make it work. And then little changes at a time to get to the overall end goal. We want to focus on those higher fiber choices, on carbohydrates, those that are minimally processed. We want to look at limiting those added sugars. Sometimes for some people, again, it's very much individualized. Some people might find a food diary for a few days to be very eye-opening. Again, because we live off of habit, and generally speaking, I feel like life is very busy, we tend to forget what we've eaten. And sometimes when we're kind of keeping track of it, it's a little bit more insightful. Oh, wow, I didn't realize every time I was stressed, I went and ate whatever, right? Sometimes it's helpful because we do eat for a lot of reasons, to kind of keep track of maybe our emotions. Maybe our emotions are kind of playing into this, or maybe I got a poor night of sleep and that's kind of impacting what I'm choosing. So for those that are more tech savvy, we do have some phone apps. There's lots of phone apps out there. This is just a small selection. So Mealime is a recipe app. It has some step-by-step cooking instructions. If you want more of an exercise meal tracker, you might look at Foodjicate. If you're just looking for how many carbs is in this food, Calorie King might be a good source for you. So again, we really want to help control our blood sugars, because really that is what's decreasing our risk of complications from diabetes. Even if you have a little smidgen down on your A1C, all those little things are making an impact on decreasing your risk of complications. Sometimes it can be overwhelming for people to think, my A1C is 9%, how am I going to get to 7%? But even if you're going 9, 8, 8.5 or whatever, you're making that impact. So you really want to cheer yourself on. And I kind of touched upon this, but really making sure you're checking with your appetite. We eat for a number of reasons. So it's a very simple concept, very difficult to do, but we want to check in with our appetite before we eat our meals and listen to that natural appetite. But, the good news is all of these things give us as individuals the power to make those changes, to impact our life, to impact our health. And even those small little changes is more than what you did the day before. So every little change is great. If we make an impact early on when you're diagnosed with diabetes, you actually do have a better long-term success on like blood sugar control. But even saying that, it's never too late to start making small changes. So I encourage that. These are my references, and I will let you take it over.
Okay, thank you so much, both Gwen and Haseena. I'm going to put both of you on the spotlight and ask questions that we have on the chat. And then depending on which one applies to you or you are able to answer to, please feel free to go ahead and do that. Our first question here is, neuropathy is a symptom of diabetes. Can you share a few more remedies in regards to this or treatments?
Yeah, I can answer that. Unfortunately, neuropathy, which is nerve damage caused by the high blood sugars, is not treatable. So it's one of those conditions that we really need to focus on bringing the blood sugars down as soon as possible so that we don't cause the permanent nerve damage. Because the nerve damage causes numbness, loss of feeling, and that's when we can get sores on our feet, leading to foot amputation. So yeah, unfortunately, the main treatment is just bringing down those blood sugars as quickly as possible before the onset of severe nerve damage. Now, once you do have nerve damage, there are some pain treatments. There's gabapentin, which is a nerve medication you can use, and some antidepressants that help with the nerve pain. And you can talk to your doctors about that. Also, exercise, helping the blood circulation will help with some of those symptoms.
Thank you. Our next question is, why does the sugar level go down close to 60 during sleep at night? Do either one of you want to take that one?
Well, I can answer part of it, and then maybe Gwen can answer some ways that we can help with that. But it depends if you're taking anti-diabetic medications or not. If you're on insulin, if you're on glipizide, what types of medications you're on, and what stage of diabetes you're at. If you're pre-diabetic or you're not even a diabetic, it could be something very different. So a lot of that depends on what medications you're on. Again, insulin can cause low blood sugars. So you would want to talk to your doctor if you're having low blood sugars at night. The dose can be changed, or the timing of your insulin injections can be changed. Also depends on which oral medications you're taking. Most commonly glipizide or glimepiride. The sulfonylureas, they can cause low blood sugars. Otherwise, you might just have to alter your diet a little bit.
Sure. Gwen, would you like to add
Yeah, no,
anything to that?
I agree. It depends on if we're talking about diabetes, or are we just, are we not talking about diabetes? And definitely impact of medications for sure is a big component. We really want to adjust medications to people's needs. If you're going low because your blood sugar is over controlled, if you will, from insulin, we don't want you to have to necessarily eat more to compensate for that. It would be important to have those medications adjusted. But having said that, in the meantime, knowing how to treat a low blood sugar, that when we talk about diabetes and we talk about low blood sugar, we're talking about blood sugars under 70. How are we treating that? Because I get a number of different answers as to how people treat it. And sometimes we treat it with treats because we're thinking something sweet. And so sometimes people will treat with chocolate or candies. And it's really important when you're treating a low blood sugar less than 70, it's important to treat with 15 grams of carbohydrate and recheck the blood sugar in 15 minutes. That simple carbohydrate should be like glucose tablets. I usually recommend, because although they're not delicious, they're very effective. They're a consistent product. They're shelf stable, and they're not tempting when they're sitting in the house, right? We can all kind of talk ourselves into things. Oh, I bought that juice. It was so expensive. I don't want it to go bad. It's almost expired. I'll just have a little bit. I'll water it down with water. So if we have glucose tablets, it's a very consistent product. We want to get that 15 grams in quickly, keep those at the bedside. We want to recheck our blood sugar in 15 minutes, make sure it's come up.
Thank you for sharing that. And another one was, can A1C impact severity of neuropathy intensity, or is that something you want to answer to, or we can move on?
Well, I think the worse control your diabetes is, the more likely you're going to get diabetic neuropathy. Now, neuropathy is one of those complications that does happen earlier on in diabetes very often. So yes, you're more likely to get neuropathy if your diabetes is out of control, which means your A1C is higher. But on the other hand, you do have to watch for it even at the lower levels of A1C.
Okay.
मैं यहाँ से चली जाऊँ, 1 घंटा है मेरी
Oh,
मीटिंग।
sorry. I'm so sorry about that. Another question is, Gwen, probably you can answer. What are some examples of healthy, diabetic-friendly snack options, like pairing them with, food combinations that you would think are good snack options for those who are diabetic?
So we did talk about making sure non-starchy vegetables are always a good friend because they do have less carbohydrate. Something simple like a carrot stick, celery, cucumbers, the baby bell peppers, minimal preparation, if you will, a little bit of hummus that's got some good protein. It has some carbohydrate. It adds some flavor. Because we're really looking at maybe 1 or 2 carbohydrate servings per meal. So you could get a couple tablespoons of that, and that would be a really good snack. It of course, we always want to pair it with people's preferences, right? I'm a big proponent of, I don't want to recommend foods that you're never going to eat, you don't like to eat. I'm also not going to tell you if these are your favorite foods. Let's say these are your favorite family foods or your favorite cultural foods. I'm not going to tell you not to eat those either, because we have to be realistic. And we want you to enjoy your food. So for someone, that may be a piece of fruit. So maybe if that's like an apple, that fiber from the apple peel, that's great. If we could pair it with a handful of nuts, again, we're kind of balancing that, giving a little bit of a healthy fat with the fiber, with the carbohydrate, to kind of pair those together. So it doesn't have to be fancy. It could be a little bit of a non-fat plain Greek yogurt. Maybe you add a teaspoon of honey, which is about 5 grams of carbohydrate. Non-fat Greek yogurt doesn't really have too much carbohydrate depending upon the brand. Maybe you have a little handful of nuts. Maybe you have some berries, because those tend to have a bigger serving size. Something like that could be really simple.
I asked a
Great.
question. What is the family history of diabetes? Like, what are the chances of someone getting diabetes because they have a family history?
Were you able to hear that? Yes.
Yeah,
Please go ahead.
so yeah, family history is definitely a risk factor for diabetes, for type 2 diabetes. It's, along with, age, and family history is definitely a very big risk factor for diabetes. So, yeah.
All right. Next question. Sourdough bread versus wheat bread. Which one is better?
So interestingly, I kind of leave this up to people's preferences, and it also depends on what does your meal look like, right? We always want to make some allowances. We talked about limiting added sugars, but we're not saying, oh, you can never eat a cookie ever again for the rest of your life. How can we fit that in? If sourdough bread is the thing you want to go to, the interesting part is because it's sour, it has a it's slightly less impactful. It's still going to impact your blood sugar because it is carbohydrate. But when we're talking about wheat bread, are we talking about wheat bread? Or are we talking about whole wheat bread? It's very tricky because manufacturers make these seeded breads. They look really healthy and fibrous, but when you look at the label, there's not that much fiber in them. So it depends. It depends on the brand. And also, right, sourdough slices could be like this. It could be like this. We kind of take that all into factor. So I wouldn't say there's a hard and fast one over another, but really looking at all of those components.
Thank you. There is a question about recording the food records or food diaries in apps. You did mention 3 of them. Do you mind repeating the names again?
Oh, yeah, sure. Mealime is a recipe app. It shows you step-by-step cooking instructions. Maybe you want to kind of branch out your cooking. Fujicate has, it looks like food with educate minus the E, Fujicate. It's a meal and exercise tracker. So maybe that might be something that you're looking at. But the Calorie King is more for just general, like, oh, how many carbohydrates are in this fruit or what?
Mm-hmm. And there is a question about how will this recording be available? Give us about a week or so. We will post it on our YouTube page. And like I said, spread the word of, spreading the awareness from the knowledge that you have gained here. Another question that we get all the time, as dietitians is, you know, there is culturally, you know, some of us do end up having a sweet tooth, right? We love our desserts, chocolates, gulab jamun, or whatnot. And then there's the food police aspect, right? Family members are like, no, no, mom, no, dad, you cannot have it. What are good ways that we can, you know, how, like, you know, what are good ways to manage that? Like, you know, in a setting, depending, you know, if it's a gathering, a Thanksgiving is coming up, you know, there's going to be desserts on the table. What are good ways in a practical standpoint that somebody can enjoy having a sweet tooth and at the same time having their blood sugar in a good, reasonable amount, allowable allowance?
Yeah, definitely. So maybe a little bit, it is tricky. It depends on how to address that with others. I mean, we know this as dietitians, people always think we're food policing people, and really we never food police people. If we're looking at your food, it's because maybe it looks delicious and we want some of it too. So that aspect, you know, addressing something like that could be something simple like, yeah, I am aware of what I'm supposed to eat, and I do manage my diabetes. Thanks for letting me know. But how do we practically do that? You know, if nobody's food policing us and we want to know, how do we fit these in? There definitely is a way. And that's where kind of that diabetes exchanges come in. Let's say we were having the rice and the chapati, and we were having some chicken curry, and we were having some fruit, and we wanted some dessert. We need to kind of exchange some of it or one of them, those carbohydrates out. It is actually a little bit more impactful to eat some of your non-starchy vegetables and your protein first. It forces your body to start digesting that first. So what that does is it forces the body to work harder to break those down. So your blood sugars are going to rise a little bit more gradually and steady, so that I would have one of those sweet treats in a smaller portion in the context of a meal with slightly less carbohydrate to kind of fit that in.
Thank you. Is drinking coconut water healthy?
I wouldn't, again, I don't like to say never, but is it healthy over water? I think water is totally fine. You know, if it's something that you like, it is going to have some carbohydrate in it. So understanding that aspect of it, it has about 10 grams of carbohydrate for a cup. So you can fit it in. So every year, the American Diabetes Association comes out with standards of care for healthcare professionals. How do we treat, how do we manage diabetes? And so the latest of 2024 actually came out saying, we really want to promote water as our go-to drink, because we know that's most hydrating. Now you can get fancy and maybe do some spa waters, maybe slice in lemons, slice in cucumbers. Sometimes I use the top of the strawberries because I'm not going to eat them anyways, and use that to flavor the water. We would rather have more of those. If you're wanting something more like carbonated, there's tons of different carbonated waters out there with flavor, without sugar substitute, something like a LaCroix or a bubbly or a Waterloo. So again, it can fit. It just depends on what you're eating. You know, I probably wouldn't drink that by itself because it does have, you know, a component of carbohydrate in it, but seeing how that could work.
Perfect. Thank you. And we are at time. Actually, we are slightly few minutes over. I really appreciate both of your expertise and excellent presentation. And I love how both of you incorporated the cultural aspects when it comes to our genetics, our, you know, lifestyles and our food, because, you know, that does take into consideration. Sometimes medical providers may or may not be aware of the practices of, different cultures. Again, there's so many things that are habitually a part of it and we're not aware. So I hope each and every one of you found this helpful. If this is your first time attending an Olive program, please visit our website. I'm going to put it in the chat right now, and you can register officially to attend our programs, and then our YouTube page. When you go on YouTube, just type Olive Community Services and all our YouTube videos will come up. So subscribe, and then you'll be alerted when we add this particular video. Again, Gwen and Haseena, thank you both for your time. I hope you enjoyed it, our group as well. Great questions, great turnout. See you again another time. Until then, bye-bye.
Olive Community Services is a 501c3 nonprofit organization based in Southern California that provides culturally appropriate services to seniors, their family, and the community. Through its physical and virtual interactive programs, Olive engages participants in a variety of ways that promotes health and well-being. To learn more about Olive Community Services, to get involved, or to make a donation, please visit www.olivecs.org or email info@olivecs.org. Be a change maker, and together, let's live, learn, and thrive.